Common Man. A cartoon character which was brought to life by famous cartoonist late R.K. Laxman. He must be wondering today, what has happened to my city? There are no people, no humming sound of bus engines, no honking and no street vendors around. One of the most populous city in the world, Mumbai, with over 20 million people, is completely deserted. Had Laxman been alive, he would have sketched his common man staring at the sea alone, listening to the sound of sea waves and the rattling sound of crows everywhere. Laxman loved crows. But crows are also a symbol of bad luck. The city is not in its lively and bustling self. The high energy, the excitement and the attitude of staying ahead of everyone was suddenly locked behind the four walls of homes. The rat race for power, fame and money seems to have vanished in thin air. Instead, the city, which boasted of countless stories of rags to riches, was looking helpless and without any ambition. Emptiness and a sense of fear gripped the city. Who has halted the fast-paced life of Mumbaikars? Who has brought the city of dreams to its knees? It's a deadly coronavirus, or COVID-19, which was galloping across the world. COVID-19 had its origin in China, where the first case emerged in December 2019. Virus was suspected to have come from bats to humans, like what happened in the case of SARS virus in early 2000. By the end of January 2020, Chinese declared a 77-day lockdown in the most affected city of Wuhan. Beijing and Shanghai were largely unaffected. By mid-March, WHO declared COVID a pandemic, a bit late in issuing a warning to the world. By that time, the virus was already spreading like a wildfire. European countries like Italy and Spain saw the biggest rise in COVID infection with close to 3 lakh cases. Germany, UK and France were running with over 2 lakh cases each by May. New York and New Jersey were the most affected. US was at the top of the charts with over 15 lakh positive cases. India was also not safe. By the end of January, the state of Kerala reported the country's first confirmed case. A month later, quite a few people tested positive in Pune and Mumbai, city of Maharashtra. The cases started to rise all over the country. By March 23, the Maharashtra government imposed a curfew. 2 days later, the Prime Minister Narendra Modi announced a 21 days nationwide lockdown to break the chain of infection. People got only 4 hours of lockdown notice. There was chaos everywhere, with people lining up for buying vegetables, grocery, medicine and whatnot. Stay-at-home orders was the only tool India had to fight the deadly virus. The lockdown was aimed at slowing down the infection and preparing the country for fighting pandemic. The country's health infrastructure in terms of hospitals, ventilators and face masks was inadequate. The lockdown was aimed at ramping up the health facilities. It was also the time to spread the awareness about social distancing. Prime Minister Narendra Modi said, and I quote, "If you can't handle these 21 days, this country and your family will go back 21 years." India had just 500 cases out of its 130 crore population when the lockdown was announced. On the 11th day, the Prime Minister requested people to switch off their electric lights at 9 p.m. for 9 minutes. Mr. Modi asked people to light candles, diyas or flash mobile lights. This was a symbolic gesture to fight collectively against the COVID-19. The Mumbaikars supported it wholeheartedly. The atmosphere was surcharged at 9 p.m. in the night. The crowd, especially kids, chanted Bharat Mata Ki Jai time and again. But there was also fear gripping the city. The lockdown meant closing down of schools, offices, malls, theaters and shops. The Mumbai police force had spread out in the city in full strength. The city saw the curfew being imposed after almost 25 years. Mumbai was the ticking time bomb for explosion of COVID cases. A crowded city, slums everywhere and a busy trade and business center. The virus could have landed in India much earlier than the lockdown, as there was no quarantining of foreign travelers between January to March. The airport authorities had merely stamped the hands of travelers. As the COVID cases spread globally, all the commercial flight operations were halted. The operations of Mumbai Port Trust, the largest port in India by size and cargo traffic, also got impacted. The best buses, the Mumbai's red boxes, that used to ferry over 30 lakh passengers daily with thousands of trips, were back in their depots. The Mumbai's lifeline, the local trains, came to a standstill. The platforms were empty, which once used to see over 2 lakh passengers using the local train services daily. The roads were completely deserted. The western and eastern express highways were barricaded. And nobody has the permission to come out of home. This was something the city never witnessed even at the height of plague or 1992 riots and the 26/11's terror attack. But this time every single life was at risk. Every single person was capable of infecting the virus to dozen others. And multiply it to thousand and lakhs. People were confined to homes. There was a terror of police. There was a terror of virus. There was a fear of losing life. The virus actually brought the families together. Everyone was playing and dining together. But this privilege was not for everyone. The migrants were the hardest hit. They had nowhere to go. These daily wage earners soon became penniless and homeless. For some, local trains became the home. Clearly, the Mumbai city was fast becoming the India's COVID epicenter. The world's most visited city by tourists was hogging the headline for all the wrong reasons. The city was topping the chart for the highest single-day increase in COVID cases. Partly, the reason was high testing and contact tracing of people, but high density, frequent movement of foreign travelers and asymptomatic cases did added to the growing numbers. There was no escape. In fact, there was more danger of a community transfer because of slums and also the way people lived in cramped houses and chawls. Within Mumbai, the biggest slum in Asia, Dharavi, emerged as the COVID hotspot. Most of the migrant population actually land in the slums of Dharavi for staying as well as working. A population of over 7 lakhs living in an area of just 2 square kilometers. Dozens of people stay under a single roof. The narrow lanes, crowded shanties and poor sanitation, Dharavi was a perfect breeding ground for virus. The experts were building different scenarios, and some of the projections were very scary. Mumbai, which crossed 17,000 cases by early May, was staring at over 30,000 cases by month end. As the cases were rising, the pressure on city's hospital infrastructure was also increasing. The state government needed more doctors, ICU facility, ventilators, beds, isolation wards and medical professionals. There was also limited capacity at the city's private hospitals. There was a fear, but there was also a glimmer of hope. The state government was putting its entire might to fight COVID. The city was wobbling. The teams of doctors were working for extended hours to save every life. The police force was on alert to enforce the lockdown and social distancing. The municipal staff was on duty to keep the city disinfected. The city was fighting back, but there were multiple challenges to handle as the virus was not showing any sign of peaking. Mumbai alone was contributing over 1/5 of the country's COVID cases. There were not enough good protective gears for health staffers. The people in some areas, especially slums, were also resisting by attacking the health workers. 2 hospitals had to be shut as many nurses and doctors tested positive for COVID-19. It was a lonely fight as every state with limited resources was on a firefighting mode. Migrant workers, without job, were fleeing the city. Businesses were shut with millions of employees uncertain about their future. The time was running out. The city needed a more effective management inside the containment zones. A faster contact tracing of the infected people was required to control the virus. COVID-19 was not the first epidemic hitting the island city. The city had earlier survived a plague attack in 1896. This was exactly 124 years back when thousands of people died and many fled the city. The city's most iconic structure, the Gateway of India, has been witness to many crises. And the city had bounced back every time, faster and stronger. Next to Gateway is the famous Taj Mahal Hotel. The world knows how a deadly 26/11's terrorist attack didn't dampen its spirits. The Heritage Hotel was back to accepting guests within a month. Taj symbolizes the fighting spirit of Mumbai. The first 21 days lockdown was done to break the chain of infection. But it was not easy. The country-wide COVID cases jumped from 500 to 80,000 cases during the last 54 days of lockdown. Clearly, people have to learn to live with the virus till a vaccine or drug is found. The state government was falling short of people to man the city. Police personnel were tired after working round the clock. Many had reported sick. Some even got infected with the virus. A big responsibility landed on the shoulders of the Mumbai's civic body. BMC's Disaster Management Control Room was working round the clock to help and guide the citizens. Mumbai, as the financial capital of India, was taking the maximum hit. The migrant workers who worked on construction sites, metro works, roads and bridges, were leaving the city. And any normalcy in business activity was expected only after a year or two. Two leading stock exchanges, the BSE and NSE, were functioning without any interruption. The central bank RBI with skeleton staff was keeping the payments and banking transaction machinery well-oiled. The private sector companies switched to work from home to do whatever little they could do during a lockdown. The worst affected were the micro, small and medium enterprises. Many such enterprises won't be able to open and many employees won't have a job once the lockdown opens. Lockdown entails a cost to the economy and its people. The unemployment rate shot up from 6% to 25% within months. An estimated 12 crore people lost their jobs. The revenue collection of both center and states crashed to all-time low. The country's GDP, which was growing at 5.0%, was expected to plunge to 1 to 2% in financial year 20 to 21. As 54 days lockdown was nearing its end, there was no option but to learn to live with the virus. It was time to fight the virus by maintaining social distancing and good hygiene. It was time for Mumbaikars to prepare to go about earning their livelihood. It was time to rebuild the business, restart work and support the city in whatever way one can. A lot was expected from the government to be ready with healthcare facilities for any outbreak, as city will be back with people in trains, roads and markets. The fight against the COVID-19 is certainly going to be a long one. So far, the good signs were very low COVID deaths in India. There was also no community spread of virus like US, Italy and Spain. The lockdown did have a role to play. But it was also time not to let your guards down. R.K. Laxman often used crows to tell his stories. And crows were plenty everywhere. There is a saying that seeing a single crow is very unlucky. If you see 2 crows, that brings good luck. And if you happen to see 3 crows, it means good health. The world today need everything that brings good health and luck.